being adopted. Now we're going to move on. And that is from Representative Randolph. You're recognized to present your amendment.
Thank you, Mr. Chairman. This simply reinstates the requirement that health insurance companies that provide coverage in Florida provide coverage for one of the most simple, treatable childhood problems, which is cleft palate. And that's the amendment.
Having presented your amendment, are there any questions of the amendment sponsor? Seeing none, is there any comments from the bill sponsor on the amendment?
Well, this amendment is again unfriendly, and focusing on the underlying condition, I think, is not what we're here today to look at. We're looking at health insurance, which is a contractual relationship between consumers and an insurance company. It's an economic transaction. Sure, this is a terrible, terrible condition, but we are saying with this bill that there is a better way to provide this type of coverage than the government mandating it into a health insurance policy. We're saying that it's up to consumers to have the necessary information available to them of the different types of healthcare conditions that exist and to make those choices based on the cost. That's what we're really talking about. So, I'm very sympathetic to all of the testimony about these terrible healthcare conditions. I would just remind the committee that that is not what the intent or the focus of the bill is.
Thank you. And do we have some public testimony on this amendment? Please raise your hand to be recognized. Ms. Warren? Please state your name, and I think we already have a card on you, do we?
Yes, sir. Thank you, Mr. Chairman. I'm Paul Wharton. Today I represent myself, and on this particular amendment, I appreciate you bringing this forward, sir. 1956, the Florida Crippled Children's Commission, now Children's Medical Services, dealt only with orthopedic conditions and did not look at a number of congenital anomalies. Insurance companies did not either. This legislature passed legislation in the 90s that added cleft palate as an insurance mandate. At that time, of the 120 House members, over 84 members were co-sponsors of that legislation, and in the Senate, 35 of the 40 senators were co-sponsors of that legislation. Parents who buy health care coverage do not know what the condition of their unborn child will be. There has been great discussion in this legislative body about the unborn children of our state and how much we value them. As a parent, I don't know what my child will look like, the gender or any other anomaly that may come with them. But I buy health insurance coverage in anticipation that whatever anomaly may present itself, that because I'm a consumer and I buy insurance, then I'm buying it with the understanding that if I need help in getting care for my child, that I could expect to receive that help. My parents were not wealthy, and having received me as their baby, it was a huge financial burden to them and to my siblings. Thankfully, I was able to get medical coverage through helping hands of physicians, dentists, orthodontists, audiologists, speech pathologists, a whole host of subspecialists. I would argue that good care is cheap care if it's done early and done by the right personnel. In the United States, we're sending medical missionaries all over the world, specifically to address cleft lip and cleft palate. What a tragedy would it be if a child born in Florida did not have access to that kind of vital care in a timely and professional manner.
Let me just kind of cut you a little short. We've got a lot of people who want to testify on the bill itself.
Yes, sir.
And I certainly appreciate your testimony on this. We will be voting on this before the end of the committee meeting today. So we have to get to everybody's testimony, and I hate to cut you short, but if there's a quick question, yes, Representative Randolph.
Thank you, Mr. Chairman. How much would this procedure cost out of pocket without insurance?
When this was done back in the 90s, there was an estimate of about, I believe it was $100,000 from birth to age 18, all inclusive. Surgeries, orthodontics, speech therapies, and other combined therapies in the life of the child.
Quick follow-up.
Quick follow-up.
Thank you, Mr. Chairman. So if this procedure wasn't covered and somebody, a parent with a new child, was suddenly found themselves in an uncovered situation because, like you said, it's not like they can determine before they get pregnant that they're going to have a child with this type of condition, and you talk about how we send missionaries out to the third world countries and to developing countries around the world. Are you suggesting to this panel that if we pass this bill, we're going to have to rely on Doctors Without Borders to come into the richest country in the world to get this procedure performed for the children of Florida?
You're recognized.
Representative, I don't know how a child would receive care, but I do know that this is not predictable generally. We know the odds are that 1 in 500 babies born will have this condition. The insurance industry was unable at your workshop in the fall to quantify what the premium level would be, plus or minus, if this were to be deleted, or what it costs them now. I simply ask that you keep this coverage in place, and remember that whether if it's your child or your grandchild yet to come, or your friend or neighbor, this is very important, and it's one of the things you can do when you leave public service and say, I did something meaningful for children.
All right, thank you. And now we'll go into debate. Any members want to debate Amendment 5? If not, Representative Randolph, you're recognized to close.
Thank you, Mr. Chairman. I would just say that this amendment, it shows exactly the absurdity of the underlying bill, which is the idea that, oh, the free market will take care of this without mandates. The whole concept of insurance is to try to take into account the unknowns of the world. A parent isn't going to know. Are we really going to get down to a state where you go, well, you had the child, but golly, you didn't have the foresight to know that you were going to have all this particular abnormality. You could have bought a rider for it, but you didn't buy the rider for this other abnormality. And this other abnormality. And so you're just not really a good consumer. The whole concept basis for insurance to begin with is to spread the risk upon these type of situations. And as we heard today, you cannot know that this abnormality is going to be in the child at any point in time during the pregnancy. Maybe at 36 weeks with the ultrasound at 36 weeks, you might be able to see it, I suppose. But to remove another mandate and really at this point, either these children are going to end up on Medicaid and we're going to be picking up that cost on Medicaid. And so, by the way, we're just socializing the cost of such a situation in exchange for corporate profits, or we're going to literally have to rely on Doctors Without Borders and other voluntary associations in the world's richest country to solve one of the most easily solvable abnormalities in a child. So I ask for your support and for this amendment, not only for not only for this, but for the whole entire concept of what insurance is supposed to be. Thank you, Mr.
Having
Chairman.
closed, let's go to roll call vote.
Representatives Ahern, Boyd. Ford.
Yes.
Gonzalez. Hudson. Jones.
Yes.
Nunes. Oliva. Forth.
Yes.
Randolph.
Yes.
Reed. Renuart.
Yes.
Rooney. Schwartz. Chairman Wood.
No.
The amendment passes.
By your vote, we show that amendment passing.